Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for confidently mastering your nursing exams. In today's video, we'll guide you through 250 true-false questions centered on the fundamentals of nursing, a foundational topic essential for building your nursing knowledge and practice. Each question is thoughtfully designed to challenge your understanding, reinforce key concepts, and provide a deeper insight into the principles that guide nursing care. After every question, we'll provide a clear and detailed explanation of the rationale behind the correct answer, ensuring you not only know the right choice but also grasp the why behind it. Whether you're just starting your nursing journey or preparing for upcoming exams, this video is packed with essential information to strengthen your foundation, improve your critical thinking, and boost your confidence. Don't forget to like, share, and subscribe to Nursing Exam Preparation for even more valuable resources. Tap the bell icon to stay updated with our latest videos. We're here to support your success with fresh, engaging content tailored to your needs. Once you've completed the quiz, share your score in the comments below. We'd love to hear how you did. Let's dive in and take a big step closer to mastering the fundamentals of nursing and achieving your goals. 1. The nurse is responsible for educating patients about their medications. True or false? Answer: true. Rationale: the nurse is responsible for educating patients about their medications to ensure safe and effective use. This falls under the nurse's role in patient education, promoting patient safety, and enhancing therapeutic outcomes. 2. A nurse should always prioritize administering medications before performing any patient assessments. True or false? Answer: false. Rationale: patient assessments should always be prioritized before administering medications. Proper assessments ensure that medications are appropriate and safe for the patient based on their current condition. 3. A nurse can delegate the task of assessing a patient's vital signs to an unlicensed assistive personnel, UAP. True or false? Answer: false. Rationale: vital sign assessment is a nursing responsibility that requires critical thinking. Nurses use this data to make clinical decisions, and it should not be delegated to UAPs. 4. Informed consent must be obtained by the nurse before a surgical procedure. True or false? Answer: false. Rationale: the physician is responsible for obtaining informed consent. The nurse's role is to ensure the patient understands the procedure and signs the consent form. The nurse can witness the signature, but does not obtain consent. 5. A nurse must follow standard precautions even if the patient's infection is known to be non-contagious. True or false? Answer: true. Rationale: standard precautions should be followed with all patients, regardless of their known infection status, to minimize the risk of healthcare-associated infections. 6. The nurse should advocate for a patient's autonomy by supporting their decision to refuse treatment, even if it goes against medical advice. True or false? Answer: true. Rationale: nurses are advocates for patient autonomy. A patient has the right to make decisions about their care, including refusing treatment, even if it contradicts medical advice, as long as they are fully informed. 7. It is acceptable for a nurse to leave a patient's medication at their bedside if the patient is able to take it themselves. True or false? Answer: false. Rationale: medications should never be left at the patient's bedside. The nurse is responsible for ensuring the patient safely takes their medication and cannot delegate the task of administering medication without supervision. 8. When communicating with a patient who speaks a different language, it is important for the nurse to use an interpreter. True or false? Answer: true. Rationale: effective communication is essential for safe patient care. Using an interpreter ensures that the patient understands the care plan and provides informed consent, promoting safety and reducing errors. 9. The nurse is not legally required to document patient care if the patient is discharged early. True or false? Answer: false. Rationale: legal and ethical standards require that all patient care, including early discharge, be accurately documented to ensure continuity of care and protect against legal liability. 10. Non-pharmacological methods, such as guided imagery, are not effective for pain management. True or false? Answer: false. Rationale: Non-pharmacological methods, such as guided imagery, are effective in managing pain, particularly in combination with pharmacological treatments. These methods can help reduce anxiety and promote relaxation, improving patient comfort. 11. A nurse is responsible for documenting all aspects of patient care, including changes in patient condition. True or false? Answer: true. Rationale: nurses are legally and ethically responsible for documenting all aspects of patient care, including any changes in the patient's condition, to ensure accurate and timely information for the healthcare team. 12. The nurse can delegate the task of providing oral hygiene to an unlicensed assistive personnel, UAP. True or false? Answer: true. Rationale: providing oral hygiene is a task that can be delegated to a UAP as long as the patient is stable and the task does not require clinical judgment. The nurse is still responsible for overseeing the task. 13. Nurses should perform a focused assessment on all patients upon admission to a healthcare facility. True or false? Answer: true. Rationale: a focused assessment helps gather baseline data, identify immediate needs, and determine appropriate interventions for patient care. This is essential for individualized care planning. 14. The nurse should immediately intervene if a patient begins to exhibit signs of an allergic reaction to a medication. True or false? Answer: true. Rationale: immediate intervention is required if a patient exhibits signs of an allergic reaction, such as swelling or difficulty breathing. This can prevent further complications or life-threatening situations. 15. It is safe to administer a medication without checking the patient's identification if the nurse is familiar with the patient. True or false? Answer: false. Rationale: patient identification must always be verified using two identifiers to prevent medication errors, regardless of familiarity with the patient. This ensures patient safety and proper medication administration. 16. The nurse is responsible for ensuring that all patients receive their prescribed medications at the correct time. True or false? Answer: true. Rationale: nurses are responsible for administering medications at the prescribed times to ensure their effectiveness. This is part of the nurse's role in promoting safe and effective patient care. 17. A nurse can delegate the task of administering medications to an unlicensed assistive personnel, UAP. True or false? Answer: false. Rationale: medication administration requires clinical knowledge and judgment. It is not within the scope of practice for a UAP to administer medications. 18. Nurses should assess the pain level of patients during each shift and after interventions. True or false? Answer: true. Rationale: pain assessment should be ongoing to ensure effective pain management. Nurses need to evaluate pain before and after interventions to assess the effectiveness of the treatment plan. 19. Patients have the right to access their medical records, but a nurse is not required to explain the contents to them. True or false? Answer: false. Rationale: patients have the right to access their medical records, and nurses should assist in explaining any information in the records to ensure the patient understands their care and treatment. 20. The nurse should always use a systematic approach when performing a patient assessment to ensure that no aspects are missed. True or false? Answer: true. Rationale: a systematic approach ensures comprehensive assessment, preventing any important findings from being overlooked. This is critical in ensuring appropriate care and interventions. 21. A nurse can perform a physical assessment on a patient without the patient's verbal consent. True or false? Answer: false. Rationale: nurses must obtain the patient's verbal or written consent before performing physical assessments, ensuring respect for the patient's autonomy and rights. 22. It is acceptable for a nurse to share a patient's private health information with a family member without consent if the family member requests it. True or false? Answer: false. Rationale: sharing patient information without consent violates confidentiality and privacy laws, such as HIPAA, unless the patient has provided written consent or the family member is the legal guardian. 23. The nurse is responsible for monitoring a patient for any adverse effects following the administration of a new medication. True or false? Answer: true. Rationale: Nurses must monitor for adverse effects after administering medications to identify any potential complications and ensure the patient's safety. 24. Nurses should advocate for patients to ensure they receive care in accordance with their wishes and needs. True or false? Answer: true. Rationale: advocacy is a key nursing responsibility, ensuring that patients' needs, preferences, and values are respected and met in the care plan. 25. A nurse must wear personal protective equipment, PPE, when caring for a patient in isolation, regardless of the type of infection. True or false? Answer: true. Rationale: PPE should always be used when caring for patients in isolation to prevent the spread of infection. The type of PPE required depends on the nature of the infection and isolation precautions. 26. A nurse can delegate the task of documenting patient care to an unlicensed assistive personnel, UAP. True or false? Answer: false. Rationale: documentation of patient care is a nursing responsibility. Accurate and thorough documentation is critical for continuity of care and legal protection, and it cannot be delegated to UAPs. 27. A nurse should immediately report any change in a patient's condition to the physician. True or false? Answer: true. Rationale: timely reporting of changes in a patient's condition is crucial for proper management and to ensure appropriate interventions are initiated. 28. A nurse should only follow written instructions from a physician, ignoring verbal orders if they are unclear. True or false? Answer: false. Rationale: verbal orders should be clarified and confirmed if they are unclear. It is the nurse's responsibility to ensure that the order is understood correctly and safely implemented. 29. It is acceptable for a nurse to apply restraints on a patient without a physician's order if the patient is a danger to themselves or others. True or false? Answer: false. Rationale: restraints should only be applied based on a physician's order, except in emergencies where immediate intervention is necessary to prevent harm. A physician's order is needed for ongoing restraint use. 30. The nurse should encourage patients to ask questions about their care and treatment options. True or false? Answer: true. Rationale: encouraging patients to ask questions promotes informed decision-making, improves patient understanding, and enhances the patient's sense of control over their care. 31. It is acceptable to share a patient's medical information with other healthcare workers who are involved in the patient's care. True or false? Answer: true. Rationale: sharing a patient's medical information is permitted within the healthcare team to provide effective care, as long as it is necessary for treatment. This is in compliance with confidentiality and privacy laws. 32. A nurse should always assess the patient's allergies before administering any medications. True or false? Answer: true. Rationale: assessing allergies is a vital step before medication administration to prevent allergic reactions or adverse effects. This ensures patient safety and prevents medication errors. 33. It is acceptable for a nurse to administer a medication even if the patient expresses concerns about its side effects. True or false? Answer: false. Rationale: the nurse should address the patient's concerns and provide education on the medication's side effects. If necessary, the nurse can consult with a healthcare provider to discuss alternative treatments or modifications. 34. Nurses should use hand hygiene before and after patient contact, even if gloves are worn. True or false? Answer: true. Rationale: hand hygiene should be practiced before and after patient contact to prevent the spread of infections, even if gloves are worn. Gloves may have small perforations, and proper hand hygiene ensures added protection. 35. The nurse should verify a patient's identification before administering medications, but it is unnecessary for non-medication tasks. True or false? Answer: false. Rationale: patient identification should be verified for all tasks, not just medication administration, to ensure patient safety and avoid errors in treatment or procedures. 36. It is the nurse's responsibility to provide emotional support to patients and families during difficult situations. True or false? Answer: true. Rationale: nurses are expected to provide emotional support as it is an essential part of holistic patient care. This support helps patients and families cope with illness or stress. 37. A nurse should always administer medication according to the prescribed dosage and time. True or false? Answer: true. Rationale: administering medications exactly as prescribed ensures the effectiveness of treatment, prevents complications, and promotes patient safety. 38. In case of an emergency, the nurse can alter a patient's medication regimen without consulting the healthcare provider. True or false? Answer: false. Rationale: any changes to a patient's medication regimen should be made in consultation with a healthcare provider, even in emergencies, to ensure the patient's safety and appropriate treatment. 39. A nurse is allowed to share patient information with a family member if the patient is unconscious and cannot provide consent. True or false? Answer: false. Rationale: even if a patient is unconscious, the nurse must respect the patient's privacy and confidentiality. Information should only be shared with family members if the patient has provided consent or the family member is the legal guardian. 40. A nurse can delegate the task of teaching a patient about a new diagnosis to a UAP. True or false? Answer: false. Rationale: patient education, particularly about a new diagnosis, requires clinical knowledge and must be performed by a nurse. This ensures the patient receives accurate, comprehensive information about their condition. 41. A nurse should always check the expiration date of medications before administering them to patients. True or false? Answer: true. Rationale: checking the expiration date ensures the medication is still effective and safe for use. Administering expired medications can lead to reduced efficacy or adverse reactions. 42. A nurse can share patient information with other members of the healthcare team as long as they are involved in the patient's care. True or false? Answer: true. Rationale: patient information can be shared within the healthcare team as long as it is necessary for providing appropriate care and is in accordance with confidentiality regulations. 43. Nurses are allowed to alter a patient's care plan without consulting the physician. True or false? Answer: false. Rationale: altering a care plan should be done in collaboration with a healthcare provider. Nurses can suggest modifications based on observations, but any changes should be communicated with the physician. 44. It is acceptable for a nurse to give a verbal report of a patient's condition to a family member if the patient is not present. True or false? Answer: false. Rationale: patient confidentiality and privacy laws prevent sharing patient information with family members without the patient's consent, even if the patient is absent. 45. The nurse should assess a patient's mental status when a significant change in their condition occurs. True or false? Answer: true. Rationale: assessing mental status helps detect changes in cognition, which can indicate changes in health or adverse reactions to medications, allowing for prompt interventions. 46. Nurses should educate patients on all aspects of their care, including treatments, medications, and lifestyle changes. True or false? Answer: true. Rationale: patient education ensures that patients are informed about their care, empowering them to participate in decision-making and improving adherence to treatment plans. 47. It is acceptable for a nurse to accept a gift from a patient if the patient insists. True or false? Answer: false. Rationale: accepting gifts from patients can create conflicts of interest or impair objectivity in care. Nurses should politely refuse gifts to maintain professional boundaries. 48. A nurse should always verify the patient's medication history during admission to identify potential drug interactions. True or false? Answer: true. Rationale: a thorough medication history helps identify possible drug interactions, ensuring that the patient's medication regimen is safe and effective. 49. A nurse should document any patient care or interventions after they are completed. True or false? Answer: true. Rationale: accurate and timely documentation is critical for maintaining continuity of care, ensuring legal protection, and providing a clear record of all interventions and patient responses. 50. A nurse is not responsible for assessing a patient's fall risk in the hospital setting. True or false? Answer: false. Rationale. Nurses are responsible for assessing patients' fall risk and implementing fall prevention measures to ensure patient safety, particularly in high-risk settings like hospitals. 51. A nurse can delegate the task of monitoring a patient's vital signs to a UAP if the patient is stable. True or false? Answer: true. Rationale. Vital sign monitoring can be delegated to UAPs if the patient is stable and the task is straightforward. However, the nurse must still assess the patient's condition and interpret the results. 52. Nurses should routinely assess a patient's bowel function to ensure proper digestive health. True or false? Answer: true. Rationale. Assessing bowel function is important in monitoring for changes in gastrointestinal health, detecting complications, and addressing issues like constipation or diarrhea. 53. A nurse can provide a patient with food or fluids before confirming a clear liquid diet order from the physician. True or false? Answer: false. Rationale. Food and fluids should only be provided according to the prescribed diet order to avoid complications, such as aspiration or nutritional imbalance. 54. The nurse should assess the patient's cultural beliefs before initiating any care plan. True or false? Answer: true. Rationale. Cultural assessments are essential for providing culturally competent care. Understanding a patient's cultural beliefs helps tailor interventions to be respectful and appropriate. 55. A nurse can use their own judgment when performing an invasive procedure without obtaining a physician's consent. True or false? Answer: false. Rationale. Invasive procedures require informed consent from the patient or their legal representative. Nurses must adhere to legal and ethical standards by ensuring that consent is obtained. 56. Nurses should always be mindful of their own biases and maintain professional, non-judgmental care for all patients. True or false? Answer: true. Rationale. Nurses must provide care that is free from bias or judgment to ensure that all patients receive fair and respectful treatment, which promotes optimal outcomes. 57. A nurse is responsible for ensuring that patients understand their discharge instructions before leaving the hospital. True or false? Answer: true. Rationale. Nurses are responsible for ensuring that patients understand their discharge instructions to promote continuity of care, prevent complications, and encourage compliance with the care plan. 58. A nurse should respect a patient's refusal of treatment as long as the patient is fully informed about the consequences. True or false? Answer: true. Rationale. Respecting a patient's autonomy means honoring their decision to refuse treatment, as long as the patient is fully informed and capable of making the decision. 59. The nurse can provide comfort care without consulting the healthcare provider. True or false? Answer: true. Rationale. Comfort care, such as pain management, can often be provided based on nursing judgment, especially in end-of-life care, without the need for immediate consultation with the healthcare provider. 60. The nurse should always maintain a sterile field when performing any invasive procedure. True or false? Answer: true. Rationale. A sterile field is essential for preventing infection during invasive procedures. Maintaining sterility ensures that the procedure is performed safely and minimizes the risk of complications. 61. The nurse should prioritize administering pain medication to a patient who has recently undergone surgery. True or false? Answer: true. Rationale. Pain management is a priority after surgery to promote comfort and recovery. Administering pain medication as prescribed ensures that the patient's pain is effectively controlled. 62. A nurse is permitted to perform an assessment without patient consent in an emergency situation. True or false? Answer: true. Rationale. In emergency situations, the nurse may perform assessments without consent to provide urgent care and stabilize the patient, as long as it is in the patient's best interest. 63. A nurse should always document patient care immediately after providing the intervention. True or false? Answer: true. Rationale. Documentation should be completed as soon as possible after an intervention to ensure accurate and timely recording of patient care and avoid missing important details. 64. Nurses should report any suspected abuse or neglect to the appropriate authorities as part of their legal and ethical responsibilities. True or false? Answer: true. Rationale: nurses are mandated reporters and are legally and ethically obligated to report any suspected abuse or neglect to protect the safety and well-being of vulnerable patients. 65. It is acceptable for a nurse to leave a patient alone during a sterile procedure. True or false? Answer: false. Rationale: the nurse should not leave a patient alone during a sterile procedure, as this could compromise the sterility of the procedure and increase the risk of infection. 66. The nurse must always follow a physician's order exactly as written, without question. True or false? Answer: false. Rationale: nurses have an obligation to question any order that appears to be incorrect, unclear, or harmful. Patient safety is the priority, and the nurse must clarify any uncertainties with the physician. 67. Nurses should assess a patient's hydration status regularly, especially in patients at risk for dehydration. True or false? Answer: true. Rationale: regular assessment of hydration status helps identify early signs of dehydration, which can lead to complications if not addressed promptly. 68. A nurse can delegate the task of assessing a patient's pain level to a UAP. True or false? Answer: false. Rationale: pain assessment requires clinical judgment and communication skills, so it must be performed by a nurse. UAPs can assist with monitoring vital signs but cannot assess pain. 69. The nurse should assess a patient's respiratory status before and after administering any respiratory medication. True or false? Answer: true. Rationale: monitoring respiratory status before and after administering respiratory medications ensures that the patient's condition is stable and that the medication is effective. 70. A nurse is responsible for ensuring that a patient's living will is followed. True or false? Answer: true. Rationale: nurses must advocate for patient autonomy and ensure that a patient's living will or advance directive is respected to guide care decisions in the event of serious illness or injury. 71. It is acceptable to delegate patient education about a new diagnosis to a UAP. True or false? Answer: false. Rationale: patient education requires nursing knowledge and judgment. Only nurses should provide education about a new diagnosis to ensure that the patient receives accurate and complete information. 72. The nurse should use a translator if a patient speaks a different language and cannot understand English. True or false? Answer: true. Rationale: using a translator ensures clear communication, allowing the nurse to obtain accurate health information and provide appropriate care, while respecting the patient's language and cultural needs. 73. It is acceptable for a nurse to administer medications prepared by another nurse without checking the labels. True or false? Answer: false. Rationale: nurses must verify the medication label to ensure the correct drug, dose, and patient. This is an essential step to prevent medication errors and ensure patient safety. 74. A nurse should report any unusual or adverse reactions to medications immediately to the healthcare provider. True or false? Answer: true. Rationale: reporting adverse reactions promptly is essential for patient safety and helps prevent further harm. It also allows for adjustments to treatment if necessary. 75. A nurse should always verify the patient's identity using 2 identifiers before administering any medications. True or false? Answer: true. Rationale: using 2 identifiers, e.g., name and date of birth, is a standard practice to ensure the right patient receives the right medication, reducing the risk of errors. 76. Nurses should inform patients about the potential risks of treatments or procedures before obtaining consent. True or false? Answer: true. Rationale: informed consent requires that patients understand the risks, benefits, and alternatives to treatments or procedures, allowing them to make well-informed decisions about their care. 77. A nurse should allow a family member to make medical decisions for a patient without first confirming legal consent or authority. True or false? Answer: false. Rationale: the nurse should confirm that the family member has the legal authority to make decisions for the patient, such as through a durable power of attorney or legal guardianship. 78. A nurse is responsible for ensuring patient confidentiality is maintained at all times. True or false? Answer: true. Rationale: nurses are ethically and legally obligated to protect patient confidentiality and share information only with authorized individuals involved in the patient's care. 79. Nurses should avoid discussing a patient's condition in public or with unauthorized individuals. True or false? Answer: true. Rationale: discussing patient information in public or with unauthorized individuals violates patient confidentiality and privacy laws, which can have serious legal and ethical consequences. 80. Nurses should always document patient interactions accurately, even if the patient is not able to communicate verbally. True or false? Answer: true. Rationale: accurate documentation is essential in all patient interactions, even when the patient is nonverbal. It ensures a comprehensive record of care and supports continuity of care. 81. A nurse should explain the purpose and potential side effects of medications to the patient before administering them. True or false? Answer: true. Rationale: providing patients with information about their medications, including purpose and side effects, empowers them to participate in their care and make informed decisions. 82. It is acceptable for a nurse to perform a procedure without obtaining patient consent in an emergency situation if the patient is unconscious. True or false? Answer: true. Rationale: in emergencies, where immediate care is necessary to prevent harm or death, implied consent is assumed, and the nurse can proceed with the necessary procedure. 83. The nurse should always advocate for the patient's needs and preferences, even if they conflict with the healthcare team's opinion. True or false? Answer: true. Rationale: nurses are patient advocates and must ensure that the patient's rights and preferences are respected, even if they conflict with the healthcare team's opinions, as long as it is safe and ethical. 84. It is acceptable to delegate the task of changing a patient's wound dressing to a UAP. True or false? Answer: false. Rationale: wound dressing changes require clinical skills and assessment, which should be performed by a nurse to ensure proper care, prevent infection, and monitor for complications. 85. Nurses should prioritize patient safety above all other tasks in clinical practice. True or false? Answer: true. Rationale: patient safety is the most important priority in nursing practice, as it ensures that patients receive the highest quality of care while minimizing risks and harm. 86. A nurse should always verify the patient's medical history before administering any new medications. True or false? Answer: true. Rationale: verifying a patient's medical history is essential for identifying potential drug interactions, allergies, or contraindications, ensuring safe medication administration. 87. Nurses should monitor patients for signs of complications after any surgical procedure. True or false? Answer: true. Rationale: postoperative monitoring helps detect complications such as infection, bleeding, or respiratory distress, allowing for early intervention and improving patient outcomes. 88. It is acceptable for a nurse to delegate the task of administering oral medications to a UAP. True or false? Answer: false. Rationale: medication administration requires clinical judgment and should be performed by a nurse to ensure proper dosage, patient understanding, and monitoring for adverse effects. 89. Nurses should assist patients in making decisions about their care by providing unbiased, evidence-based information. True or false? Answer: true. Rationale: nurses should provide patients with accurate, unbiased information, empowering them to make informed decisions about their care while respecting their autonomy. 90. Nurses are responsible for assessing and documenting a patient's level of pain before and after interventions. True or false? Answer: true. Rationale: pain assessment before and after interventions is essential for evaluating the effectiveness of pain management strategies and adjusting care as needed to maintain comfort. 91. The nurse should ensure that all patient care equipment is cleaned and disinfected after each use. True or false? Answer: true. Rationale: proper cleaning and disinfecting of patient care equipment prevent the spread of infections and ensure patient safety during each use. 92. A nurse can administer medication to a patient if the doctor's order is unclear but the medication is urgently needed. True or false? Answer: false. Rationale: the nurse should clarify any unclear orders with a physician before administering the medication to ensure patient safety and prevent medication errors. 93. The nurse must perform a thorough assessment of a patient before initiating any nursing interventions. True or false? Answer: true. Rationale: a thorough assessment ensures that nursing interventions are tailored to the patient's specific needs and conditions, promoting safe and effective care. 94. When a nurse delegates a task, they are still responsible for ensuring that the task is completed correctly. True or false? Answer: true. Rationale: while tasks can be delegated, the nurse remains accountable for the outcome and must supervise and evaluate the performance of the task. 95. A nurse should always prioritize patient needs based on the severity of the condition rather than the order of arrival in the emergency department. True or false? Answer: true. Rationale: in an emergency setting, prioritizing care based on the severity of a patient's condition ensures that those in the greatest need receive prompt attention and intervention. 96. A nurse should only communicate with patients using medical terminology to maintain professionalism. True or false? Answer: false. Rationale: effective communication with patients requires that nurses use language that is understandable to the patient, avoiding medical jargon and ensuring clarity. 97. The nurse is responsible for ensuring that the patient has signed a consent form before any invasive procedure. True or false? Answer: true. Rationale: it is the nurse's role to ensure that the patient has signed a consent form, which verifies that the patient understands the procedure, its risks, and benefits. 98. A nurse can perform a physical assessment without informing the patient about what the assessment will involve. True or false? Answer: false. Rationale: the nurse must inform the patient about the procedure and what to expect to ensure the patient's understanding and consent, promoting comfort and trust. 99. Nurses should encourage patients to ask questions and express concerns about their care plan. True or false? Answer: true. Rationale: encouraging open communication helps build trust, provides the nurse with important information, and ensures that the patient is informed and involved in their care. 100. A nurse should not administer medications if the patient refuses, even if the medication is prescribed. True or false? Answer: false. Rationale: while respecting patient autonomy is crucial, the nurse should explore the reasons for refusal and educate the patient about the benefits of the medication to facilitate informed decision-making. 101. Nurses are responsible for monitoring vital signs after the administration of medications that could affect the patient's cardiovascular system. True or false? Answer: true. Rationale: monitoring vital signs after administering medications that affect the cardiovascular system is essential to detect any adverse reactions and ensure patient safety. 102. A nurse should only document care if a patient shows a positive outcome following an intervention. True or false? Answer: false. Rationale: accurate documentation must reflect all patient care, including both positive and negative outcomes, to maintain an accurate and complete patient record. 103. The nurse is responsible for ensuring that the patient's privacy is maintained during all aspects of care. True or false? Answer: true. Rationale: nurses must uphold patient privacy by ensuring that personal information is protected and that care is delivered in a manner that respects the patient's confidentiality. 104. It is acceptable for a nurse to ignore a patient's complaint of pain if the vital signs are normal. True or false? Answer: false. Rationale: pain is a subjective experience, and the nurse should always assess and address pain, regardless of vital signs, to provide comprehensive care and improve patient comfort. 105. Nurses should avoid using physical restraints unless absolutely necessary and after other alternatives have been exhausted. True or false? Answer: true. Rationale: physical restraints should only be used as a last resort after less restrictive alternatives have been considered, to protect the patient and prevent harm. 106. A nurse should ensure that medications are double-checked before administering, especially high-risk medications like insulin. True or false? Answer: true. Rationale: double-checking high-risk medications such as insulin helps prevent medication errors and ensures that the patient receives the correct dosage. 107. It is acceptable for a nurse to allow a patient to make decisions about their care even if the decisions may result in harm. True or false? Answer: false. Rationale: nurses must respect patient autonomy, but are also responsible for ensuring that decisions do not result in harm. If a decision may harm the patient, the nurse should provide further education and support to help the patient make informed choices. 108. Nurses should avoid charting in a patient's medical record while they are performing patient care. True or false? Answer: false. Rationale: nurses should document patient care during or immediately after the intervention to ensure accuracy and maintain a real-time record of the patient's condition and treatment. 109. The nurse should always verify the patient's identity using 2 identifiers before performing any procedure. True or false? Answer: true. Rationale: using 2 identifiers, such as the patient's name and date of birth, is a standard practice to prevent errors and ensure that the right patient receives the correct procedure or treatment. 110. A nurse can delegate the task of giving medications to a UAP. True or false? Answer: false. Rationale: medication administration requires clinical judgment and should only be performed by a nurse to ensure safety, proper dosage, and monitoring for side effects. 111. Nurses must inform patients about the potential side effects of medications they are prescribed. True or false? Answer: true. Rationale: patients have the right to understand the potential side effects of medications to make informed decisions and recognize adverse reactions early. 112. A nurse should remove a patient's personal items from their hospital room without the patient's consent. True or false? Answer: false. Rationale: the nurse should respect the patient's belongings and ask for consent before removing personal items to ensure the patient's comfort and dignity. 113. A nurse should assess a patient's cognitive function as part of the initial assessment for a new admission. True or false? Answer: true. Rationale: assessing cognitive function during the initial assessment helps identify any changes in mental status, which may indicate underlying issues that need further evaluation. 114. A nurse should place an oxygen mask on a patient with respiratory distress even if they are unable to speak. True or false? Answer: true. Rationale: if a patient is in respiratory distress, administering oxygen is the priority to stabilize the patient, regardless of their ability to communicate. 115. A nurse can administer a blood transfusion without obtaining informed consent if the patient is unconscious. True or false? Answer: false. Rationale: even in emergency situations, implied consent may apply, but it is important for the nurse to attempt to obtain informed consent whenever possible to respect the patient's rights. 116. A nurse should ensure that a patient is positioned comfortably before initiating a procedure. True or false? Answer: true. Rationale: proper positioning promotes patient comfort, reduces the risk of injury, and ensures that the procedure can be performed safely and effectively. 117. It is acceptable for a nurse to delegate the task of teaching a patient about a new diagnosis to a UAP. True or false? Answer: false. Rationale: teaching a patient about a new diagnosis requires clinical knowledge and skills, which should be performed by a nurse to ensure the patient receives accurate and thorough information. 118. A nurse should inform the patient and family members about any changes in the care plan as soon as they occur. True or false? Answer: true. Rationale: timely communication about changes in the care plan helps ensure that the patient and family are well informed and involved in the decision-making process. 119. Nurses should always ensure that the patient's family members are informed about the patient's condition, even if the patient has not provided consent. True or false? Answer: false. Rationale: nurses must respect patient confidentiality and only share information with family members if the patient has given consent or if required by law. 120. A nurse should always wear gloves when handling blood or body fluids to minimize the risk of infection. True or false? Answer: true. Rationale: Wearing gloves when handling blood or body fluids is a standard infection control practice to protect both the nurse and the patient from potential exposure to infectious agents. 121. Nurses are required to monitor for side effects when administering new medications to a patient.
True or false?
Answer: true. Rationale: monitoring for side effects is essential to ensure patient safety and identify adverse reactions early, especially when starting a new medication. 122. A nurse can delegate the task of ambulating a patient to a UAP, unlicensed assistive personnel, without providing any supervision. True or false? Answer: false. Rationale: while UAPs can assist with ambulation, nurses must assess the patient's condition first and provide supervision to ensure safe execution of the task. 123. A nurse should encourage patients to stop smoking before any surgical procedure to promote optimal healing. True or false? Answer: true. Rationale: smoking impairs wound healing, reduces oxygen delivery to tissues, and increases the risk of complications, so encouraging smoking cessation before surgery is beneficial. 124. A nurse should ensure that all patient records are kept confidential, even in case of emergencies. True or false? Answer: true. Rationale: patient confidentiality must be maintained in all situations, even in emergencies, to respect privacy and comply with legal and ethical standards. 125. It is acceptable for a nurse to give a patient their medication in a non-labeled container if the original container is unavailable. True or false? Answer: false. Rationale: medication should always be given in its original, labeled container to avoid medication errors and ensure that the correct drug and dosage are administered. 126. A nurse should educate a patient about the risks and benefits of treatment, even if the patient is not asking questions. True or false? Answer: true. Rationale: providing education proactively ensures that patients are informed about their treatment options and helps in making autonomous, informed decisions about their care. 127. A nurse can delegate the task of assisting a patient with feeding to a UAP if the patient is unable to feed themselves. True or false? Answer: true. Rationale: UAPs can assist with feeding patients, but the nurse must assess the patient's ability and ensure that the environment is safe and conducive to feeding. 128. A nurse should document a patient's refusal to take prescribed medications only if the patient provides a reason. True or false? Answer: false. Rationale: all medication refusals should be documented, regardless of the reason, to maintain accurate records and alert the healthcare team of the patient's choice. 129. Nurses should assess a patient's cultural background before planning care to provide culturally competent care.
True or false?
Answer: true. Rationale: understanding a patient's cultural background allows the nurse to tailor care to the patient's specific needs and preferences, improving patient satisfaction and outcomes. 130. A nurse should always confirm the patient's identity before administering any medication.
True or false?
Answer: true. Rationale: confirming the patient's identity with two identifiers, e.g., name, date of birth, helps prevent medication errors and ensures that the right patient receives the correct treatment. 131. A nurse can delegate the responsibility of documenting a patient's vital signs to a UAP. True or false? Answer: false. Rationale: while UAPs may collect vital signs, nurses are responsible for interpreting the data, documenting them accurately, and using the information to guide care decisions. 132. A nurse should allow a patient to make decisions about their treatment plan, even if those decisions may not be in their best interest. True or false? Answer: false. Rationale: while respecting patient autonomy is essential, the nurse has a responsibility to educate the patient about the potential risks and benefits of treatment to ensure informed decision-making. 133. Nurses are responsible for ensuring that a patient's informed consent is obtained before a surgical procedure.
True or false?
Answer: true. Rationale: the nurse should verify that the informed consent process is completed, ensuring that the patient understands the procedure, its risks and benefits, although the physician typically provides the explanation. 134. A nurse can delegate medication administration to a UAP for a stable patient.
True or false?
Answer: false. Rationale: medication administration requires clinical knowledge, and UAPs are not trained to administer medications safely. Only licensed nurses can perform this task. 135. A nurse should intervene if a patient is not following prescribed dietary restrictions. True or false? Answer: true. Rationale: nurses are responsible for educating patients about dietary restrictions and intervening if patients do not comply, as it could impact their health and recovery. 136. It is acceptable for a nurse to perform a nursing procedure without proper patient consent if it is an emergency situation. True or false? Answer: true. Rationale: in emergency situations, implied consent is often accepted when the patient is unable to provide consent and the procedure is necessary to save life or prevent harm. 137. Nurses should only use medical terminology when communicating with other healthcare professionals. True or false? Answer: false. Rationale: nurses should tailor their communication to their audience. When speaking with patients, they should use layman's terms to ensure understanding and clarity. 138. A nurse can delegate a task to a UAP if it is beyond the UAP's scope of practice. True or false? Answer: false. Rationale: nurses must delegate tasks that are within the UAP's scope of practice. Delegating tasks outside their scope can result in legal consequences and harm to the patient. 139. A nurse is responsible for verifying the accuracy of the patient's medication list upon admission. True or false? Answer: true. Rationale: accurate medication reconciliation is critical to prevent medication errors and ensure that patients receive appropriate medications during their hospital stay. 140. A nurse should assess for any allergies before administering any medication. True or false? Answer: true. Rationale: assessing for allergies before medication administration is vital to prevent allergic reactions and ensure patient safety. 141. A nurse can delegate a task to a UAP without considering the patient's condition or stability. True or false? Answer: false. Rationale: nurses must consider the patient's condition and stability before delegating tasks to ensure that appropriate care is provided and that the UAP has the skills required to perform the task safely. 142. Nurses should provide pain management for patients in acute pain based on the physician's orders, even if the patient reports a higher level of pain. True or false? Answer: false. Rationale: the nurse must assess the patient's pain and advocate for appropriate pain relief, adjusting the pain management plan as needed based on the patient's report. 143. A nurse should always verify the physician's orders before carrying out any interventions. True or false? Answer: true. Rationale: verifying physician orders helps prevent errors and ensures that the planned interventions are safe, appropriate, and accurately executed. 144. A nurse should always encourage patients to wear hospital gowns to ensure a sterile environment. True or false? Answer: false. Rationale: patients should be encouraged to wear appropriate clothing for their comfort and dignity, but hospital gowns may be necessary for procedures or when maintaining sterility. 145. Nurses should evaluate a patient's understanding of their diagnosis and treatment before proceeding with care. True or false? Answer: true. Rationale: evaluating a patient's understanding ensures that the patient is informed about their care and can actively participate in decision-making, promoting better outcomes. 146. A nurse should remove a patient's for access immediately if there is any sign of infection or complication. True or false? Answer: true. Rationale: early intervention and removal of the for access site are necessary to prevent further infection or complications such as phlebitis or infiltration. 147. A nurse is allowed to accept gifts from patients as long as the gift is small and does not affect patient care. True or false? Answer: false. Rationale: nurses should avoid accepting gifts from patients to maintain professional boundaries and avoid conflicts of interest or ethical dilemmas. 148. A nurse should assess a patient's mental health status regularly during hospitalization. True or false? Answer: true. Rationale: regular mental health assessments are important for detecting changes in a patient's emotional and psychological state, which may affect treatment and recovery. 149. Nurses are required to provide patient care that respects the patient's right to refuse any form of treatment or procedure.
True or false?
Answer: true. Rationale: nurses must respect patient autonomy and provide care that aligns with the patient's wishes, even if the patient chooses to refuse treatment or procedures. 150. It is acceptable for a nurse to provide care to a patient who has not signed a consent form for treatment in an emergency situation.
True or false?
Answer: true. Rationale: in emergency situations, implied consent applies and care should be provided without explicit consent when immediate action is required to prevent harm or death. 151. A nurse should avoid using medical jargon when explaining procedures to patients.
True or false?
Answer: true. Rationale: using simple, understandable language helps patients comprehend the information, reducing anxiety and promoting better communication. 152. A nurse can delegate medication administration to a UAP as long as the medication is in oral form.
True or false?
Answer: false. Rationale: medication administration should be performed by licensed nurses, as they are trained to assess, educate, and monitor the effects of medications. 153. Nurses should always assess a patient's allergies before starting any new treatment.
True or false?
Answer: true. Rationale: assessing allergies helps prevent potential allergic reactions to medications, treatments, or procedures, ensuring patient safety. 154. It is acceptable for a nurse to share a patient's medical information with a family member if the patient has not provided explicit consent.
True or false?
Answer: false. Rationale: nurses must adhere to patient confidentiality laws, and patient consent is required before sharing medical information with family members or others. 155. A nurse can delegate a patient's personal hygiene tasks to a UAP, regardless of the patient's condition. True or false? Answer: false. Rationale: nurses must consider the patient's condition before delegating tasks. Personal hygiene tasks can be delegated to UAPs, but nurses are responsible for assessing the patient's ability to perform these tasks. 156. A nurse can allow a patient to leave the hospital against medical advice if the patient is mentally competent.
True or false?
Answer: true. Rationale: a mentally competent patient has the right to refuse care and leave the hospital, but the nurse must inform the patient of the potential risks and consequences. 157. A nurse is responsible for verifying the correct surgical site before a procedure. True or false? Answer: true. Rationale: nurses are responsible for verifying the correct surgical site as part of the surgical safety checklist, which is essential to prevent wrong site surgeries. 158. A nurse should always assess the patient's pain level before administering pain medication. True or false? Answer: true. Rationale: assessing pain levels helps the nurse determine the appropriate dosage and effectiveness of pain management interventions. 159. It is acceptable for a nurse to discuss a patient's condition with a colleague without patient consent as long as it is for educational purposes. True or false? Answer: false. Rationale: discussing patient conditions without consent, even for educational purposes, violates patient confidentiality and privacy regulations. 160. A nurse should ensure the patient's comfort and dignity when providing personal care, even if it takes extra time. True or false? Answer: true. Rationale: providing care with respect for the patient's comfort and dignity enhances their experience and promotes positive therapeutic relationships. 161. Nurses are not responsible for interpreting a patient's lab results. This is the responsibility of the physician. True or false? Answer: false. Rationale: while physicians interpret lab results, nurses are responsible for reviewing results and ensuring timely communication with the physician regarding critical findings. 162. A nurse should encourage a patient to get out of bed and walk around to reduce the risk of complications after surgery.
True or false?
Answer: true. Rationale: early ambulation after surgery helps prevent complications like blood clots, pneumonia, and muscle atrophy. Nurses should encourage movement as soon as it is safe. 163. A nurse should delegate the task of inserting a urinary catheter to a UAP if the patient is stable. True or false?
Answer: false.
Rationale: inserting a urinary catheter requires clinical judgment and skill, so it should only be performed by a licensed nurse, not a UAP. 164. A nurse should never leave a patient alone if they are at risk of falling, regardless of the patient's condition.
True or false?
Answer: true. Rationale: preventing falls is a priority in patient safety, and nurses should never leave patients who are at risk unattended to minimize the risk of injury. 165. A nurse can accept verbal orders from a physician over the phone without confirming the order in writing.
True or false?
Answer:
false.
Rationale: verbal orders should be confirmed in writing to ensure accuracy and prevent misunderstandings, as they can lead to medication or treatment errors. 166. A nurse should advocate for a patient's right to refuse treatment, even if the nurse believes the treatment is necessary.
True or false?
Answer: true. Rationale: nurses must respect patient autonomy and advocate for the patient's right to refuse treatment after being informed of the risks and benefits. 167. It is acceptable for a nurse to discuss a patient's diagnosis with a family member if the patient is unconscious. True or false?
Answer: false.
Rationale: even when a patient is unconscious, confidentiality must be maintained, and consent should be obtained before discussing medical information with family members. 168. Nurses should assist patients with proper positioning to prevent pressure ulcers, especially for patients who are bedridden.
True or false?
Answer: true. Rationale: proper positioning and frequent repositioning help prevent pressure ulcers in immobile patients, as they reduce pressure on vulnerable body parts. 169. A nurse can delegate the task of administering medication to a UAP as long as the medication is non-oral.
True or false?
Answer: false. Rationale: UAPs are not qualified to administer medications, whether oral or non-oral. Medication administration requires professional judgment and clinical knowledge, which is the nurse's responsibility. 170. Nurses must always perform a head-to-toe assessment on a newly admitted patient.
True or false?
Answer: true. Rationale: a head-to-toe assessment is essential for establishing a baseline of the patient's health status and identifying any existing health issues that need immediate attention. 171. A nurse should allow a family member to make healthcare decisions on behalf of a patient who is mentally competent but unable to express themselves.
True or false?
Answer: false. Rationale: the patient's autonomy should be respected as long as they are mentally competent, and the nurse should help facilitate communication rather than delegating decision-making to family members. 172. A nurse is responsible for ensuring that a patient has received adequate pain relief before starting a procedure.
True or false?
Answer: true. Rationale: nurses must assess and manage pain to ensure that the patient is comfortable before proceeding with any procedures, as pain can affect the patient's physical and emotional well-being. 173. It is acceptable for a nurse to delegate the task of making a patient's bed to a UAP.
True or false?
Answer: true. Rationale: making a patient's bed is a non-technical task that can be safely delegated to UAPs, allowing nurses to focus on more complex care activities. 174. A nurse should verify a patient's understanding of their medication regimen before discharging them.
True or false?
Answer: true. Rationale: ensuring that patients understand their medication regimen before discharge is vital to ensure adherence, reduce errors, and promote recovery. 175. Nurses can delegate the task of measuring a patient's vital signs to a UAP if the patient is stable. True or false? Answer: true. Rationale: UAPs can measure vital signs for stable patients, but nurses are responsible for interpreting the findings and taking appropriate actions based on the results. 176. Nurses should assess a patient's dietary needs based on their medical condition before administering a meal. True or false? Answer: true. Rationale: assessing a patient's medical condition, such as diabetes or renal disease, helps the nurse ensure that the patient receives appropriate nutrition that aligns with their health needs. 177. A nurse should notify the healthcare provider if a patient is experiencing complications following a procedure, even if the nurse believes the complications are minor. True or false? Answer: true. Rationale: it is important to communicate any changes or complications, no matter how minor they may seem, to the healthcare provider to ensure appropriate follow-up care and prevent further issues. 178. A nurse should review a patient's medication history before administering any medication. True or false? Answer: true. Rationale: reviewing a patient's medication history helps prevent drug interactions and ensures that the medication is appropriate for the patient's current condition. 179. Nurses are responsible for ensuring that patients are comfortable and informed about their care throughout their hospitalization. True or false? Answer: true. Rationale: ensuring that patients feel comfortable and informed promotes trust, enhances the patient experience, and contributes to better healthcare outcomes. 180. It is acceptable for a nurse to perform any procedure without explaining the steps to the patient if the patient is in pain. True or false? Answer: false. Rationale: nurses must explain procedures to patients to ensure that they are informed and that their consent is obtained. The explanation can help reduce anxiety and ensure the patient is prepared for the procedure. 181. A nurse should always assist patients with repositioning every 2 hours to prevent pressure ulcers. True or false? Answer: true. Rationale: repositioning patients regularly is a key intervention to prevent pressure ulcers, as it reduces prolonged pressure on vulnerable areas of the body. 182. Nurses can delegate the task of feeding a stable patient to a UAP. True or false? Answer: true. Rationale: feeding stable patients is a task that can be delegated to UAPs, but nurses must ensure that the patient is able to eat and that there are no swallowing risks. 183. Nurses should avoid making assumptions about a patient's care needs based on their cultural background. True or false? Answer: true. Rationale: assumptions can lead to biases and suboptimal care. Nurses should ask open-ended questions to understand individual patient needs, preferences, and values. 184. A nurse should only document patient information that is directly related to the care provided. True or false? Answer: true. Rationale: documentation should be accurate, concise, and focused on the care provided, ensuring that the record is relevant and can be used for future decision-making. 185. A nurse can administer an oral medication to a patient who is unconscious if the medication is prescribed. True or false? Answer: false. Rationale: administering oral medication to an unconscious patient is unsafe, as they may be at risk for aspiration. Medications should be administered according to the patient's ability to swallow and follow instructions. 186. A nurse must perform a full assessment every time a patient is admitted to the hospital. True or false? Answer: true. Rationale: a thorough assessment is necessary to gather baseline data, identify immediate care needs, and guide the development of the patient's care plan. 187. It is acceptable for a nurse to discuss a patient's medical condition with a colleague outside of the hospital. True or false? Answer: false. Rationale: patient information should be kept confidential and discussed only within the healthcare team, following HIPAA guidelines and organizational policies. 188. A nurse should monitor a patient's urinary output after surgery to detect any early signs of complications. True or false? Answer: true. Rationale: monitoring urinary output is an important part of postoperative care, as it helps detect complications such as dehydration or kidney dysfunction. 189. A nurse is responsible for ensuring that all patient documentation is accurate and complete. True or false? Answer: true. Rationale: accurate documentation is essential for patient safety, continuity of care, and legal purposes. Nurses must ensure that all information is clear and complete. 190. A nurse should encourage patients to participate in their care, even if they do not fully understand their medical condition.
True or false?
Answer: true. Rationale: encouraging patient participation improves self-management, promotes better outcomes, and helps patients feel more in control of their health. 191. Nurses should document a patient's pain level using a standardized pain scale. True or false? Answer: true. Rationale: using a standardized pain scale allows for consistent and objective measurement of pain, helping to guide treatment and monitor changes over time. 192. It is acceptable for a nurse to administer a medication prescribed by a physician without verifying the patient's identity.
True or false?
Answer: false. Rationale: verifying the patient's identity is a critical step in medication administration to prevent errors and ensure that the right medication is given to the correct patient. 193. Nurses should prioritize safety and comfort over speed when providing patient care.
True or false?
Answer: true. Rationale: ensuring patient safety and comfort is paramount, even if it takes additional time, as it promotes better outcomes and prevents errors or harm. 194. A nurse can administer an injectable medication without confirming the patient's allergies if the medication is routine.
True or false?
Answer: false. Rationale: confirming the patient's allergies is essential before administering any medication, even if it is routine, to avoid potential allergic reactions. 195. A nurse should document a patient's condition immediately after a change occurs.
True or false?
Answer: true. Rationale: timely documentation ensures accuracy, helps guide further treatment, and provides a clear record of the patient's condition. 196. A nurse can delegate wound care to a UAP for a patient with an uncomplicated wound.
True or false?
Answer: false. Rationale: wound care involves assessment and clinical decision-making, which should be performed by a licensed nurse. 197. A nurse should always offer patients the opportunity to express their concerns or fears about treatment.
True or false?
Answer: true. Rationale: allowing patients to express concerns promotes therapeutic communication, alleviates anxiety, and fosters trust between the patient and nurse. 198. A nurse can delegate the task of documenting patient care to a UAP.
True or false?
Answer: false. Rationale: documentation of patient care is a critical responsibility that must be performed by a licensed nurse, ensuring accuracy and legal compliance. 199. A nurse should assess a patient's vital signs before administering medication that could affect the cardiovascular system.
True or false?
Answer: true. Rationale: assessing vital signs is necessary before administering medications that affect cardiovascular function to ensure the patient's stability and safety. 200. A nurse should encourage patients to participate in decision-making regarding their care.
True or false?
Answer: true. Rationale: involving patients in decision-making promotes autonomy, enhances patient satisfaction, and contributes to better health outcomes. 201. A nurse can delegate the task of monitoring a patient's blood pressure to a UAP.
True or false?
Answer: false. Rationale: monitoring blood pressure involves clinical judgment, and it should be performed by a licensed nurse to assess for abnormalities and intervene if necessary. 202. It is acceptable for a nurse to share patient information with a family member if the patient is not present.
True or false?
Answer: false. Rationale: patient information must be kept confidential, and disclosure without consent or the patient's presence is a violation of HIPAA guidelines. 203. A nurse should verify a patient's identity before administering a medication.
True or false?
Answer: true. Rationale: verifying a patient's identity is a crucial step in preventing medication errors and ensuring that the right patient receives the correct medication. 204. A nurse can delegate medication administration to a UAP if the medication is oral.
True or false?
Answer: false. Rationale: medication administration, including oral medications, requires a licensed nurse's knowledge of pharmacology and patient response to ensure safety. 205. A nurse should assess a patient's pain level before administering any pain-relieving medication.
True or false?
Answer: true. Rationale: assessing pain before administering pain medication helps to evaluate the effectiveness of the medication and guide appropriate treatment. 206. A nurse should never leave a patient in an unsafe environment.
True or false?
Answer: true. Rationale: ensuring patient safety is the nurse's primary responsibility, and leaving a patient in an unsafe environment may result in harm or injury. 207. A nurse can administer medications that are prescribed by a physician, even if the medication is not on the hospital formulary.
True or false?
Answer: false. Rationale: nurses should administer medications that are included in the hospital formulary or have been authorized through appropriate channels to ensure safety. 208. A nurse should explain the purpose and potential side effects of medications to a patient.
True or false?
Answer: true. Rationale: providing information about medications empowers patients to make informed decisions and promote safety by reducing the risk of adverse effects. 209. A nurse should perform a skin assessment for all patients, especially those who are at high risk for pressure ulcers.
True or false?
Answer: true. Rationale: regular skin assessments, particularly for high-risk patients, help identify early signs of pressure ulcers, which can lead to complications if not addressed promptly. 210. A nurse should always use proper hand hygiene before and after patient contact.
True or false?
Answer: true. Rationale: hand hygiene is the most effective method to prevent the spread of infection and protect both the nurse and patient from healthcare-associated infections. 211. A nurse can delegate patient education regarding discharge instructions to a UAP.
True or false?
Answer: false. Rationale: patient education is a responsibility that falls under the nurse's scope of practice, as it requires clinical knowledge and understanding of individual patient needs. 212. A nurse can administer an intramuscular injection to a patient without confirming the site of the injection.
True or false?
Answer: false. Rationale: the correct injection site must be confirmed before administration to prevent complications and ensure proper medication delivery. 213. A nurse should involve a patient's family in the care planning process.
True or false?
Answer: true. Rationale: involving family in the care planning process enhances patient support, improves communication, and encourages a collaborative approach to care. 214. A nurse can delegate the task of taking vital signs to a UAP for a patient in a stable condition.
True or false?
Answer: true. Rationale: vital sign measurement can be delegated to a UAP for stable patients, but the nurse is responsible for interpreting the results and responding appropriately. 215. A nurse should assess the patient's mental status before administering any medication that affects the central nervous system.
True or false?
Answer: true. Rationale: assessing mental status helps ensure that medications do not exacerbate existing conditions, such as confusion or sedation. 216. It is acceptable for a nurse to leave a patient's medication at the bedside for them to take later.
True or false?
Answer: false. Rationale: medications should never be left unattended or administered without supervision to ensure safety and prevent errors. 217. A nurse should assess a patient's respiratory status before administering medications that affect the respiratory system.
True or false?
Answer: true. Rationale: assessing respiratory status ensures the patient can safely tolerate medications that affect breathing, such as opioids or sedatives. 218. A nurse can delegate the task of assisting a patient with feeding to a UAP.
True or false?
Answer: true. Rationale: assisting with feeding is within the scope of a UAP's duties, provided that the patient does not have any swallowing or aspiration concerns. 219. A nurse should encourage patients to report any new or unusual symptoms.
True or false?
Answer: true. Rationale: encouraging patients to report new symptoms helps identify complications early and facilitates prompt intervention. 220. A nurse should verify the dosage of a medication if it is not written clearly on the medication order.
True or false?
Answer: true. Rationale: verifying unclear medication dosages helps prevent medication errors and ensures safe administration. 221. A nurse can perform a procedure without obtaining the patient's consent if it is considered routine. True or false? Answer: false. Rationale: informed consent must be obtained for any procedure to ensure the patient understands the risks and benefits of the procedure. 222. A nurse should document patient care and interventions promptly after providing care. True or false? Answer: true. Rationale: prompt documentation ensures accuracy, provides a clear record of care provided, and supports continuity of care. 223. A nurse can delegate the task of administering a subcutaneous injection to a UAP. True or false? Answer: false. Rationale: subcutaneous injections require nursing knowledge and skill to ensure proper technique, safety, and response to the medication. 224. A nurse should maintain confidentiality regarding a patient's health information. True or false? Answer: true. Rationale: patient confidentiality is protected by law and is a fundamental ethical responsibility in nursing practice. 225. A nurse can delegate the task of changing a patient's dressing to a UAP. True or false? Answer: false. Rationale: dressing changes involve assessment and clinical judgment, requiring a licensed nurse to perform this task. 226. A nurse should always perform a complete patient assessment before initiating any new care plan. True or false? Answer: true. Rationale: a comprehensive patient assessment helps ensure that care plans are tailored to the individual patient's needs and condition. 227. A nurse can delegate the task of assisting with a patient's activities of daily living to a UAP.
True or false?
Answer: true. Rationale: assisting with activities of daily living, ADLs, is within the scope of a UAP's responsibilities, provided the nurse supervises and ensures proper care. 228. A nurse should always follow hospital policies and procedures when providing patient care. True or false? Answer: true. Rationale: following hospital policies and procedures ensures that care is delivered safely, consistently, and according to best practices. 229. A nurse can administer a blood transfusion without verifying the patient's identity. True or false? Answer: false. Rationale: verifying the patient's identity is a critical step in blood transfusion to prevent transfusion errors and ensure safety. 230. A nurse should assess a patient's pain level regularly, even if the patient does not complain of pain. True or false? Answer: true. Rationale: regular pain assessments help identify hidden pain and provide opportunities for early intervention to manage discomfort. 231. A nurse can administer a medication if it is not prescribed by a physician, but the nurse believes it is appropriate. True or false? Answer: false. Rationale: nurses must follow physicians' orders and cannot administer medications that have not been prescribed or authorized through proper channels. 232. A nurse can delegate the task of monitoring a patient's blood glucose level to a UAP for patients without diabetes. True or false? Answer: true. Rationale: monitoring blood glucose for patients without diabetes is not a complex task and can be delegated to a UAP for routine checks. 233. A nurse can delegate the task of giving a patient a bed bath to a UAP. True or false? Answer: true. Rationale: bed baths are within the scope of a UAP's duties, provided that the patient does not have complex care needs requiring nursing judgment. 234. A nurse should provide a quiet and safe environment for a patient who is confused. True or false? Answer: true. Rationale: a calm environment helps reduce confusion and anxiety, ensuring the safety and well-being of the patient. 235. A nurse should assess for signs of dehydration in patients who are receiving diuretics. True or false? Answer: true. Rationale: diuretics can increase fluid loss, and regular assessment for signs of dehydration helps prevent complications. 236. A nurse can administer a medication without checking the patient's allergy history if the patient has taken the same medication before. True or false? Answer: false. Rationale: a patient's allergy history should always be checked before administering any medication, as allergies can develop over time, even to medications previously tolerated. 237. A nurse should explain the risks and benefits of a procedure to a patient before it is performed. True or false? Answer: true. Rationale: providing information about the procedure allows the patient to make an informed decision and ensures that consent is obtained. 238. A nurse can delegate the task of transferring a patient from a bed to a wheelchair to a UAP. True or false? Answer: true. Rationale: transferring a patient to a wheelchair can be delegated to a UAP, provided the patient is stable and the UAP is trained to perform this task safely. 239. A nurse should monitor the patient's vital signs after surgery to assess for complications. True or false? Answer: true. Rationale: monitoring vital signs post-operatively helps detect early signs of complications such as hemorrhage, infection, or respiratory distress. 240. A nurse can delegate the task of applying a condom catheter to a UAP. True or false? Answer: true. Rationale: a UAP can apply a condom catheter, but the nurse should ensure that the patient's skin is intact and monitor for any signs of skin irritation or complications. 241. A nurse should administer a blood transfusion without first verifying the patient's blood type. True or false? Answer: false. Rationale: it is critical to verify the patient's blood type and match it with the donor blood to prevent transfusion reactions. 242. A nurse can delegate the task of assisting a patient with oral hygiene to a UAP. True or false? Answer: true. Rationale: assisting with oral hygiene is within the scope of a UAP's duties, as long as the patient does not have specific complications requiring nursing interventions. 243. A nurse should document patient care after completing the task, but not during or before. True or false? Answer: false. Rationale: documentation should be done in real time or immediately after the task is completed to ensure accuracy and legal compliance. 244. A nurse can administer a medication that is prescribed for another patient if the first patient is unavailable. True or false? Answer: false. Rationale: administering medication to a patient other than the one it was prescribed for is a serious violation of medical protocols and patient safety. 245. A nurse should assess the patient's ability to swallow before administering any medication. True or false? Answer: true. Rationale: assessing swallowing ability is important, especially for patients with risk factors like dysphagia, to prevent aspiration. 246. A nurse should assess a patient's pain level using a standardized pain scale before administering pain medications. True or false? Answer: true. Rationale: a standardized pain scale helps in quantifying the patient's pain level, ensuring appropriate medication management and pain relief. 247. A nurse can delegate the task of taking a patient's vital signs to a UAP for a patient with unstable health.
True or false?
Answer: false. Rationale: unstable patients require more frequent and detailed assessments, which need to be performed by a nurse to make clinical judgments. 248. A nurse can delegate the task of emptying a patient's urinary catheter bag to a UAP. True or false? Answer: true. Rationale: emptying a urinary catheter bag is a non-complex task and can be delegated to a UAP as long as the nurse ensures proper technique and hygiene. 249. A nurse can delegate the task of feeding a patient who is receiving enteral nutrition to a UAP. True or false? Answer: false. Rationale: enteral nutrition requires careful monitoring and assessment, and the nurse should perform this task to ensure safety and prevent complications. 250. A nurse should always ensure that the patient's privacy is maintained during physical assessments. True or false? Answer: true. Rationale: protecting patient privacy during assessments is essential to maintain dignity and comply with confidentiality laws.